Hello everyone, I Rohini Bembalgi from InNews welcome you all for today's session. Today we are celebrating World Kidney Day. Every year on second Thursday of March, we celebrate World Kidney Day. It is a joint initiative of ISN and IFKF. With us today, we have two doctors to speak about kidney health. They are from Haryanth Hospital. It's a multi-speciality hospital started by Dr. MD Dikshit. To speak more about kidney health, with us today we have two doctors from Haryanth Hospital. Dr. VijayKumar Patil, a nephrologist, Dr. Amit Mungarwadi, a urologist. They both are from Haryanth Hospital. Haryanth Hospital is a multi-speciality hospital started by Dr. MD Dikshit. So let's start today's session by talking with two doctors with us. What is the importance of global theme, kidney health for all?
This global theme of kidney health for all. So basically everybody knows about cardiac diseases and cardiac problems, then stroke and all other related problems, and nowadays everybody knows about COVID and all these things. But the knowledge about kidney disease is very less, and it is the one of a leading cause of death worldwide. So hence, to increase the awareness of this kidney diseases among people, so this initiative has been started by International Society of Nephrology. So this year's theme is kidney health for all. That is providing the kidney health, that is early diagnosis of the kidney diseases, the education regarding the kidney diseases, and the management of these kidney diseases. This should be accessible to everyone in spite of whatever their caste, creed, religion, or whichever country or region they belong to. So this health care facility should be accessible to all. So that is what is this year's theme.
What are the causes of these kidney diseases?
So basically kidney diseases, the most common causes of kidney diseases are because of our lifestyle habits. Like our lifestyle diseases like diabetes and hypertension are the most common causes of kidney diseases and kidney failure. Then we have some diseases that people get because of the swelling of the kidney. We call it as glomerular diseases. And some diseases are because of increased over-the-counter medications intake, like painkillers. Then this unregulated health supplement intake or alternative medications intake. Or else in patients who have family history with kidney diseases, and there are some congenital kidney diseases which the child will have from the birth itself. And so these are a few causes of kidney diseases basically.
So how we get to know what are the symptoms of these diseases?
So basically the irony of kidney disease is that 90% of the kidney diseases are asymptomatic. So only 10% of the kidney patients have symptoms. So usually these symptoms are swelling of face, then swelling of lower limbs, then passing of frothy urine, then passing of blood in the urine, or passage of sometimes stones, and then patients can have generalized symptoms like nausea, vomiting,
loss of weight,
and
loss of appetite.
And decreased sleep. These are all the symptoms of kidney failure, and sometimes it can be as meager as just generalized weakness, or with the patient can be just ignoring his symptoms, but later we find out that it is related to the kidney failure itself. So these are main problems of kidney failure. And regarding the kidney stones and all things, I think Amit sir will be telling you better.
Almost all the individuals, right from pediatric, adult, and elderly. So this summer being very common in this season, we usually get renal stone patients. Dehydration is the most common factor that causes the precipitation of the crystals. Renal stones are nothing but they are the precipitations of minerals and acid salts. So the most common causes are dehydration, supersaturation, then sedentary lifestyle, then to add to it diabetes and hypertension, for which patients can have urinary tract infection. These all are the causes for renal stones.
There are so many things in kidneys, but most of the things we heard is kidney failure. This word is so scary. What exactly is this kidney failure?
Basically, kidney failure is when the kidneys normal functions which are done by the kidney are dysregulated. So in the sense, usually the normal functions of the kidney is removal of the waste toxins from the body, removal of excess salt from the body, and removal of excess water from the body, then regulation of our bones, metabolism of the bone, then maintaining of normal healthy environment in the whole body, and also mainly looking after the synthesis of blood in our body. These are the basic functions of the kidney. So whenever any of these functions is deranged, so that is what we call as kidney failure. So basically kidney failure is of two types. That is, one is called as acute renal failure and second one is called as chronic renal failure. So acute renal failure, in speaking in common man's terminology, we can call it also as temporary renal failure, in which if the patient is properly treated on time, so that the patient's renal failure will be reversed back to normal and the person can have a normal life. And chronic renal failure, we also what we call it as permanent kidney failure. So in this, the symptoms have been for more than 3 months in this patient. So because of this, the kidney disease has progressed to such an extent that we cannot reverse back the disease in this patient. So this disease is a progressive kind of disease. Only thing is that we can halt the speed of progression of this disease, but this disease cannot be completely reversed back. So that's why we call it as also as permanent kidney failure, or also we call it as chronic kidney disease.
So how to take care of this? Any precautions, and how we will get to know we have a kidney disease? Any warning signs?
So as I previously told, most of the kidney diseases are asymptomatic basically. So for this purpose, we have a certain group of patients whom we call as high risk people. So like people with diabetes, hypertension, family history of kidney diseases, people who are having chronically taking painkillers, taking other unregulated health supplements or alternative medications, or patients who have young onset hypertension, that is hypertension at very young age if they have. So these patients need to undergo checkup to get to detect their kidney diseases, because most of the kidney problems are asymptomatic. Other than that, the patients, as I told you, so usually if there is any change in the color of the urine, that is if they are passing reddish urine, or they are passing a lot of froth in the urine, or there is reduction in the urine output of them, or else if they are seeing any swelling of the limbs, face, all these things. So these are the red flag signs that will tell you that there is some problem with their kidneys and they need to consult a specialist. And to prevent the kidney diseases, as I told you, the people with risk factors, they should have their regular checkups done. So avoiding smoking, alcohol, then avoiding over-the-counter medications, drinking plenty of adequate amount of water, and controlling your blood pressure and sugars, and eating a healthy food and having a healthy lifestyle should help in preventing kidney diseases or help in retarding the progression of kidney disease.
So now, what are the options available for kidney failure patients?
So as I told you, kidney failure. So usually in patients with permanent kidney failure, usually it's of 5 stages. So usually in the first 4 stages, what we do is, whenever we find out at which stage the patient is, we try to give some medicines to these patients, change their lifestyle, change their water intake, salt intake in such a way that they don't progress to other further stages. But there is one stage called as stage 5 kidney disease, that is also called as end stage renal disease. End stage because if these patients are not treated with a specific form of therapy called as renal replacement therapy, so these patients will end up dying. So usually in renal replacement therapy, we have 2 options, that is dialysis and kidney transplantation. So dialysis is a process in which we usually we have a machine in which the patient's blood is regularly taken out, cleaned and given back to the patient. So dialysis is a process in which the blood of the patient is cleaned basically. So again, dialysis is of 2 types, hemodialysis and peritoneal dialysis. In hemodialysis, the patient comes to the hospital, so in which we connect the patient to a machine in which the blood of the patient is taken out, cleaned and given back. So the patient needs to do this weekly 2 to 3 times. And the second type of dialysis is peritoneal dialysis, in which we put a tube in the patient's abdomen and then we insert certain fluids into the patient's abdomen, and the fluid will clean up the blood, and then again that fluid is removed and again new fluid is inserted. So this process can be done by the patient at home itself, and he needs to do this every day 2 to 3 times. So this is called as peritoneal dialysis.
Amit sir, can you tell about the recent happened kidney transplant in the Haryanth Hospital?
Yeah, we did our first transplant in the month of December 2023. So we got a 26-year-old male patient who came presented to us with a history of hypertension. So on evaluating, we got to know that he was suffering from stage 5 renal disease, renal failure. So we tried to put him on dialysis, and he needed 2 to 3 weekly dialysis. Even with those 2 to 3 weekly dialysis, he was not maintaining. So what we thought was the permanent solution to this would be renal transplant. So we asked him, and then his mother was ready, and we did cross matching and all. So she was a fit candidate for him to give her kidney. So we proceeded, and the nephrological part evaluation was done by Dr. Vijay. I went ahead with the surgical part. So December last week, we did renal transplant. It was a successful renal transplant, and immediately on the OT table only, patient started throwing urine. Good quantity of urine was there, and eventually his creatinine came down from 13 to 1. And now the patient is doing very well and is maintaining creatinine around 1, and is not, and as of now he is free of dialysis.
What are the causes of kidney stones, and what are the different types of kidney stones?
Kidney stones are nothing but the supersaturation of the minerals and the salts. There are many causes for renal stone formation. One is dehydration, one is recurrent UTIs. There are many types of stones. There are calcium oxalate, calcium phosphate, two-white stones. Two-white stones are more commonly seen in urinary tract infection, patients with recurrent urinary tract. Then we find uric acid stones, which patients where the uric acid content is very high, like in gouts, or patients who consume a lot of non-veg, like fish. And cystine stones. Cystine stones are seen in patients with genetic diseases where there is a lot of cystinuria. That means the cystine content in the urine is very high, thereby causing precipitation and cystine stone formation.
So can you tell our audience how kidney stones are treated?
Yeah, kidney stones, depending upon the site, size and location, and how hard the stones are, we can treat kidney stones. 90% of the stones, usually they don't need any surgical management, only on medical management they get expelled out. Most of the times hydration is the main thing, and we give citrates. Then we ask the patient, there are certain foods that has to be advised to eat and not to eat, and there are some medicines that will help in the medical expulsion. Second, coming to the surgical part, there are many procedures. Again, as I told, depending upon the site where the stone is located, we have to proceed. If the stone is located in the kidney, without doing any surgical incision, we can go ahead and we do RIRS, that is retrograde intrarenal surgery, where we use laser. And if they are located in the ureters, that is the tube connecting the kidney and the bladder, if they are located there, then without taking any incision over the body, what we do is we usually put a scope. Then we go near the stone and we fragment it, and we bring the fragments out. So there are also ways wherein we can treat stone by just giving shock waves. That we call it as extracorporeal shock wave lithotripsy. That again depends. If the stones are very hard, we cannot do this. We have to go ahead with the surgical line of management.
So what household remedies do you suggest to prevent kidney stones?
Yeah, we can ask the patient to hydrate themselves a lot. Minimum at least 3 liters of water is required. At homes, most common available thing is coconut water. We can ask them to drink a lot of coconut water. Even barley water we can suggest. Then we have to ask patients, depending upon what type of the stone is. We get to know by doing stone analysis what type of the stone is. We can ask them to change their dietary habits. We can, if it is a uric acid stone, then we usually ask the patients not to eat a lot of non-veg and fish, as they are very much rich in uric acids. And if it is calcium oxalate and phosphate stones, we ask the patient not to eat. It's not that not to eat, they can eat in lesser quantities, like tomatoes, auxiliary foods like tomatoes and brinjal. So they can reduce altogether. You can't completely stop eating these vegetables. So to some extent, dietary regulations can be done to decrease the incidence of stone formation. But altogether, it can't be told that we can completely stop the recurrence, or completely prevention is not possible. To some extent, we can avoid, or you can prolong the incidence rate.
Nowadays, it's common that younger generation are getting more kidney diseases. So, what may be the reason for that?
So again, basically, like as I told, as sir was also saying, basically our sedentary lifestyle and too much consumption of this aerated drinks, fast food, then again global warming adding up to that, and these are the most common lifestyle changes that have been happening recently. And also there are some causes called as CKD of unknown origin. That is, in these developing countries, younger generations are developing kidney failures without any known causes. So usually these are basically farming communities. So the reasons are not known, but some tell that these reasons are usually attributed to overuse of pesticides in the food or over exposure to sun and drinking lot of this sugar containing drinks and all these things. These are other causes with which younger people are suffering from kidney failure. So that is what is the price we are paying for our modernization.
So this was our today's session. It was really very informative about kidney health. Today on World Kidney Day, let's promise with other organs we take care of our kidney too. Not to neglect any body warnings. Keep yourself hydrated, be healthy, eat healthy. Being a fancy lifestyle is not about eating what you want. It's all about eat what your body requires. Take care of your body, take care of yourself. That is the place where you live. Thank you everyone.